And we are back once again right here on the number one rated business show. Like I told you, I'm committed to bringing some of the best individuals in the Georgia area to you guys in business, in medicine, in health. I mean, everywhere, all over the board. Today, we celebrating a special day. It's Physicians Day, Doctors Day. So today, I got two special women with me today. Two doctors from body. I'm not even gonna go there. Dr. Baron and Dr. Familusi. How we doing today?
We're doing good.
Good,
Thank you
good.
for having us.
It's all the bees that mess me up.
It's all good.
I'm
It's all
sorry.
good.
But if you would just give our audience the official name of the practice.
Breast, body, beauty, plastic and reconstructive surgery.
All right. Now, I'm first of all honored to have you guys here in the studio with me today. So definitely, I appreciate y'all taking time out your busy schedules because I know plastics is a field that's blowing up right now. Y'all do the Brazilian butt lift?
We do it all, but we do it safely.
Yeah, because I done seen some nightmares.
And
Like,
naturally.
why is these people going down to Mexico?
Because it costs,
Oh my goodness.
but you get what you pay for.
Well, let's back up a little bit and let's start from what got you into this field because this is typically not a field that you see a lot of black surgeons in. Honestly, it's always it's funny all over medicine. We started to really look at the statistics and we see that we only like 1-2% of most of these fields. And I know with you doctors, I mean, you guys are doing something truly historic because I don't think there's another black ran plastics practice anywhere in the nation.
Well, there's black-owned plastic surgeons,
Not by two
or
female
office,
doctors.
but definitely not two black female doctors. And so I feel very honored to bring Dr. Familusi on board so that we can provide exceptional service or continue to provide exceptional service to all of our patients and really have this kind of really groundbreaking moment within plastic surgery. But, going back to your question, what started
Yeah.
at least me into the field. The variety of
Okay.
plastic surgery is very attractive. You could be operating from head to toe, young to old, really on almost any surface of the body. And then also, the types of patients that we work with. They're awesome. They're relatively healthy. So,
Okay.
we don't really have to deal with a lot of morbidity within our field.
Okay.
And so the improvement, the way in which you can improve the quality of life of a patient is really what's most rewarding. So I tell people all the time, I may not be saving a life like physically by doing heart surgery,
Okay.
but I might be saving one by drastically improving someone's quality of life.
Oh yeah. I mean, for some people, it's life saving procedures because when you've dealt with a certain issue that's made you feel bad for so long and all this other type of stuff, it's like when you finally have that lifted off you, it's definitely life changing.
Yeah,
Absolutely.
I think for sure the psychological impact of some of the procedures that we perform is really, really groundbreaking for some patients. But echoing a lot of what Dr. Barron said, there's a level of creativity and artistry that comes with plastic surgery that you just don't get from other specialties. But then you also have you really get to connect with your patients and really you can truly, truly form those connections with them and restoring form, restoring function. It's something that really sets plastic surgery apart from a lot of other specialties. And there's just so much variety. Even between the two of us, we both perform reconstructive, anesthetic, or cosmetic surgery,
Okay.
but we can specialize in different aspects of that. So Dr. Barron does a lot of breast and body surgery, body contouring, and I do that as well. But I also really enjoy doing some facial rejuvenation procedures. So, for example, that's your non-surgical cases, so your Botox and fillers,
Okay.
which are much more popular now, and
Oh,
I think
yeah.
are becoming much more mainstream. But also, you have the surgical aspect of that, so facelifts and rhinoplasties and otoplasties, which is more of like pinning your ears back or a lip lift. So the list goes on. And I think that creativity and that variety is what draws a lot of people to plastic surgery.
Wow. Do I need facial rejuvenation? I'm just wondering.
Well, so we can always do some facial balancing and create some harmony.
No, you did
You
not.
look fine. The thing is, and I think what Dr. Familusi is trying to say is that, everybody should have the opportunity to continue to age gracefully.
Oh yeah.
So people, look fine. There's nothing wrong with them or anything like that. But a lot of times, as you get to age, if you want to avoid having, wrinkles that are very prominent, at rest when you're not moving your face or animating your face, and sometimes doing preventative Botox or sometimes preventative fillers will make sure you kind of maintain that youthful appearance and age gracefully.
And the key word is gracefully. I think graceful refinement of what people already have is what most plastic surgeons are after. And that's really the crux of the practice that we have is natural, graceful, and creating longevity. You can create some changes right now, but we want to make sure that those changes age well with you and last a lifetime.
Wow. Now, what was it like for you? And what really led you to plastic surgery? Like, what interested you so much in this field to take this route in medicine?
Well, at least for me, when I was in medical school, I, got into, at first I wanted to be OBGYN. And so I was president of the OBGYN club, vice president, all of that. And then I went and did my surgical rotations. And very first day I got into the operating room, I said, I have to be in here all the time. So OBGYNs, they operate as well, but I just needed more volume. And so I started exploring the different surgical subspecialties. And, I was initially a little bit between orthopedics and plastic surgery. I just liked the operations and I liked the people I encountered. The plastic surgeons I met were pretty down to earth. I felt like they had personalities similar to me.
They some cool people.
Plastic surgeons are always happy.
Yeah, and so and then I looked at the types of operations and I thought that they were just so fascinating. Like you could be doing cleft lip palate repairs on children, all the way to, breast reconstructive surgery for cancer patients, so I like the variety there. And then, I did away rotations and, I just fell in love with it.
Mm. I used to actually work in the medical field, and I used to be a surgical tech for podiatry practice.
Oh, cool.
So I know all about standing there behind the mask and having to stand there still, can't let your hands down.
Right.
The upside is the podiatry cases are a little shorter.
Yes, they're definitely
We've had some. I had a couple days in that OR where we was for like 3 or 4 hours, and it was springtime. And my allergies was bothering me real bad, and I'm behind this man. Oh my goodness! Anyway, that's a whole nother story. So what led you to plastic surgery?
Interestingly enough, I also at one point was thinking about OBGYN. It's funny. I feel like it's either cardiac surgery for a lot of plastic surgeons or OBGYN is what they were thinking about first. But I'm Nigerian. Lived in Nigeria for a little bit. I still have a lot of family there.
Wow.
And when I was in college, I knew I wanted to be a doctor and I was going to spend some time shadowing my uncle, who's an orthopedic surgeon in Nigeria. So that was going to be some of my exposure. And I went there, saw some orthopedic cases, and I was like, this is not for me at all. And he had a colleague who was a plastic surgeon. And he said, well, why don't you spend the rest of the summer with her? And I was just fascinated with the procedures that were going on. Some of them were trauma reconstruction. Some of them were as straightforward as a breast reduction. But just the changes that were that the surgeons were creating for these patients, I was set from that moment. Came back, and as soon as I started medical school, I was like, where is the plastic surgery office? Where are the plastic surgeons? How can I spend more time with them? And that was really sort of what started me. So I went into medical school knowing that I wanted to be a plastic surgeon.
Wow.
And just stayed right on that path until here.
I went into college not knowing what I wanted to do. I still don't someday. Anyway, what type of patients or what type of people do you guys typically see in your practice? Because, of course, everyone assumes it's just women going to get mommy makeovers and this type of stuff. But what type of cases do you guys see?
We see a wide range. The majority of patients that end up coming to our practice are women. Okay. But the door's open really for anybody. I would say probably about 75, percent are women, the others men. It's patients who, it's not just rich patients who are coming to get plastic surgery, and spend thousands of dollars. The majority of patients are average middle class people who want to improve an aspect of their body, or, change something because they either had a child. A lot of my patients are postpartum. They're moms who want to have a mommy makeover and kind of get back or, make an improved version of themselves after having kids. So that's kind of the demographic that at least I see mainly in the practice, patients who want breast and body surgery. But it's women, it's men, it's basically anybody who wants to, improve an aspect of their, body that has bothered them or has just changed.
Okay.
As a result of it. But like I said, middle class people who, instead of, maybe taking a vacation that year, will spend on themselves and treat themselves. So it's affordable. Some people feel like it's completely out of reach, but it is affordable, but you should do it responsibly when it comes to, economics.
Oh yeah, definitely.
Mhm.
What I was watching on TV one time, and it was the weirdest thing to me. Maybe it's not weird to y'all, but this guy he was getting I think liposuction, but they was also adding like fake muscles on him.
Oh, I see.
So are you talking about like high definition liposuction or implant?
No, implants. I
Okay.
think
Yeah,
that
he was
a
getting
guy who-
actually
yeah.
because he wanted his biceps to be bigger.
Yeah.
Yeah, so I mean, there are several different ways that you can enhance different parts of your body, and some of that is with liposuction, and there's a combination in the techniques that you're doing with the liposuction where you can actually sculpt the body,
Mhm.
and that's referred to as high definition liposuction. You have to be a good candidate for that, and I think that's why it's so important to find a surgeon who's going to be honest with you, because you never want to have a bad result. You don't want a surgeon who's going to do exactly what you want because you want it.
Okay.
You want a surgeon who's going to tell you realistically, at the point that you are at, this is the result that I think you can get. And if you're not going to be happy with that result, maybe we need to do something else to get you to that point. So I think that's really the most important part. And then when it comes to implants, there are certain parts of the body that we can, in the same way that you can place a breast implant for an augmentation,
Okay.
there are certain parts of the body that you can place implants as well to increase definition or to change the contour.
What's some of the most interesting procedures you guys have done?
I think on a reconstructive scale, it's probably free flat breast
Mhm.
reconstruction, and that essentially entails moving tissue from one part of the body, specifically, usually the abdomen,
Okay.
the belly, and disconnecting the blood vessels that feed that skin and fat, and moving it to the breast. And that's for patients who have had breast cancer, where they need to remove the breast tissue.
Okay.
So you use that tissue from the belly, the skin and the fat, and connect that to blood vessels using a microscope and very small instruments, very small suture material. So the thread that we're stitching the vessels up with, and put that in to help create a new breast for the patient.
Wow.
Long surgery,
But it's one of my favorites.
Really?
I think it's
Yeah.
probably one of the more interesting
Yeah.
procedures that we do on the reconstructive
So,
side.
so you literally just suck the fat out and then you
No,
inject
no.
it back.
It's actually transplanting that tissue.
so you
So
take
you
it
take
from
that
far.
chunk, so almost like the same chunk that you would cut off with a tummy tuck and
Okay.
throw in the trash. You dissect out an artery and a vein that will supply that that tissue and keep it living. So
Wow.
it's literally using spare parts on a patient, to reconstruct something. So, with plastic surgery, it's almost like nothing goes wasted. It's like one surgeon's trash is a plastic surgeon's treasure when it comes down to it. But with that operation, it's life-changing for women. They can get a breast reconstruction that will sustain them lifelong without having to have another surgery or get an implant replaced or anything like that. So, I mean, I would say that's the most interesting surgery for me as well.
Wow.
It's one of my favorite operations, and it's called the deep flap operation. It's named for the blood vessel, but it's a free flap surgery. It takes a lot of skill and expertise. We undergo
I can
a lot
imagine
of,
if you got to reattach a blood supply
yeah,
to it.
it's a
That's
microvascular surgery.
that's
So
next
you do
level.
you do it with either an operating room microscope or like very high magnification surgical glasses to be able to see those things as tiny as they are.
Wow.
And then for me, on the cosmetic or aesthetic side, I think blepharoplasties are my favorite
You
operations.
said bluffer?
Blepharoplasty. So it's basically
Blethro.
blepharoplasty.
Bletharo. Okay.
Yeah.
That's all right. Get me right.
So it's okay. It's okay. So it's basically an eyelid lift.
Okay.
And some patients will just need an upper eyelid lift, and some patients also need a lower eyelid lift. And the reason why I like it so much is because it's for the patient, the recovery is not so burdensome, but it really sort of rejuvenates the entire face. If you think about how much time when you speak to someone, what you're really focusing on is their eyes, like this portion of their face. So often, and the scars are very minimal. Sometimes you can't even see the scars because we're hiding them on the inside.
Okay.
And really, patients just are rejuvenated and they just look so good and they're so happy. And it really takes up to 10 years off of them. And they're just so happy.
Wow, and that removes like the bags under the
Yeah,
eyes.
that
Yes,
surgery is for
exactly.
bags on the eyes, or if patients feel like they have a tired look,
eye.
or if they have
Mhm.
skin that's drooping over the top eyelid.
Okay.
It can really be, it will just open the eyes. The patient will look refreshed. They'll see people and they'll be like, "What did you have
What,
done?"
and they can't, no
They
one
can't
can really
pinpoint it.
tell. They're like,
Yeah.
did you get your hair done? You look well rested.
Did you get a vacation?
Where,
Like,
where
yeah.
have you been? Do you have
I noticed a few
Yeah.
years back, women started putting the lighter eyeshadow under there
So it
to
basically
reduce the appearance of that.
Yeah, it basically helps with that.
Or you might have heard of, like, I think Bobby Brown did like an interview saying that he put preparation H
Oh,
on
my
his
goodness.
eyelid bags because it actually shrinks that.
Okay.
So
I've
that's
heard of
kind
people
like,
using preparation H for something other than
Well,
what is.
yes, yeah,
But
because
that's a
what
new
you
one.
intended. That was an off-label use.
I'd be
for
scared to go
that.
get my eye.
So I mean, it's basically taking care of the bags.
Wow.
People always want to put their best foot forward when it comes to their face.
Oh yeah.
And so I think operation like that definitely appeals to it.
And saying people want to put their best foot forward, I think that really is one of my goals is to really show patients and educate patients about how facial rejuvenation and facial surgery can seem scary to some patients because
It
everyone's
sounds
like,
scary
oh,
to me.
yeah, but the recovery oftentimes is much easier than surgery on the body.
Okay.
And it really just has such a profound effect on self-esteem, on the way that on confidence, the way people present themselves. Because again, it's like you said, you're putting your best face forward. And really it's just trying to destigmatize this idea of, oh, I can't touch my face. And it's not necessarily touching. I think as long as you find the right surgeon and for me, the most important thing for my patients is one, that they trust me, and two, that they know that safety is my number one priority. I'm not going to do anything if I don't think it's safe. And then two is I'm not going to do anything that's not going to look natural on you.
Okay.
So I think just helping people understand that this isn't anything to be afraid of. And it's something that can really, really help improve how you feel about yourself.
Wow. Now I have seen that, over the last, I'd say probably 5, 6, 7 years, it's been like an explosion in plastic surgery. It's like everybody's starting to do it now. It used to be, like you say, reserved for rich white women and that type of thing. But now you're starting to see just a wide range of people doing it. Number one, explain the dangers of going to these other countries and having these procedures done. Not the main fact folks getting killed down there, but the other side of it, the medical side of it, the danger.
So I think the first thing that I'll say is that there are well-educated, well-trained surgeons in countries outside of the U.S. So I don't want it to ever be like, we're American, we think we're better than there are
Right.
a lot of very well-trained plastic surgeons across the world.
Okay.
But there are also a lot of people who are basically either pretending or trying to lure people in for the financial gain. And I think it's difficult for patients to sift through that.
Oh, yeah.
And I think one of the biggest dangers is really you want your surgeon to be nearby, right? So every operation is major for the patient, right? Because maybe you've never had surgery before. You want your surgeon close by to you so that you can ask questions. So if you have any issues, you can go see them, things like that. So you want your post-operative course to be something where you have a close rapport with your surgeon. If you're going really far away, it's number one, that's already removed. So that's one of the biggest risks to me. And two, it's you just don't know what you don't know what you're getting. There might be a language barrier. There's so many different things. I'll let Dr. Baron talk a little bit more about that.
Yeah, and I echo the same sentiments. It's questions in different countries. You may have you haven't seen the facility in which you might potentially be having this operation.
Okay.
You may not know if there are issues with sterility or cleanliness or anything like that. And then you likely have not built a relationship with the surgeon that you're seeing. You hear people going, it's medical tourism is basically what it is. Maybe talk to like a patient consultant or coordinator prior to. They fly down, meet the surgeon literally minutes before this surgery is supposed to happen. How do you trust that this person really is on the same page as you, when it comes to your body? I tell patients when I cut on them or operate, like it's the most intimate type of relationship you will probably have, because I see pieces of you and parts of you that no one will ever see.
Okay.
And so I don't take that lightly. And so I never operate on a patient without having built at least an initial consultation relationship with them and talk to them about their plan. And I want to feel comfortable, just as much as a patient is potentially interviewing me, I'm interviewing the patient when it comes to deciding who to operate on. And so, I think that stable doctor-patient relationship is not really fostered when you're flying in and flying out afterwards. And so you see patients, if they have a complication, they're very unhappy with everything. But part of that is because that trust was never built to begin with. They felt like, oh, he didn't do or she didn't do what, I said that they were supposed to do. Well, you kind of just, showed up for surgery and paid some money and, didn't really have a defined plan. You really didn't have time to think about it. So, like Dr. Familusi said, lots of great surgeons all over the country. And the thing is that, or all over the world, a lot of these, surgeries where patients are getting injured and are harmed or dying, they're here in the United States as well.
Wow,
So
okay.
you have surgeons who, like she said, for financial gain, or not even surgeons, other doctors who, who aren't trained plastic surgeons. They have not gone to residencies in order to be trained. They take a weekend course or they shadow somebody and they say, okay, well, I'm going to stop being an OBGYN and I all of a sudden want to be a cosmetic surgeon. So I'm going to hang a shingle and say that I'm a cosmetic surgeon now. And, it puts patients at risk. There's no way to equate our 14 plus years, six years of which are directed towards plastics and reconstructive surgery. There's no way to equate that to a couple of weekend courses, or even at the most, maybe 40, 100 hours or something of, supplemental courses. Like there's no way to equate that training. And, and a lot of what we learn is not just cosmetic or anything. We are experts in reconstructive surgery. Whatever happens in the operating room or afterwards, I can fix.
Okay.
Because we know how to reconstruct and almost any complication, know. And so when you have not been adequately trained in reconstruction, you can't do that. And so the patient ends up coming to us, because they've had some sort of complication that their other doctor can't fix. So those are things that patients want to watch out for. You would think that everybody, the surgeons should be ethical and really able to disclose what their training is. But the patients, I tell them, just as much as you're going to research a house and shop around or a car and do your research, you have to do the same with your surgeon. Absolutely. Because, it can be life-changing.
Instagram is not good enough research.
Right.
Now tell me this: what was going on when you started to see like all these women? I think they were getting a Brazilian butt lift, and like the tissue was dying, or it was just like dropping, or something like that was going on. I forgot. It's one of them housewives, I think, that did it, and then it really exploded onto the scene. Everybody started paying attention.
So, so what can happen if the tissue dies or is, sometimes people over inject fat. So historically, the Brazilian butt lift is where you liposuction fat from somewhere else and then it's re-injected into the buttocks. And so if you over inject, then that fat graft cannot get adequate blood supply. And so, and your skin envelope, your skin can only hold so much. So it either starts to squeeze back out the incisions and leak, or it can internally dye and cause hard spots.
Wow.
A lot of women on TV as well have not had the Brazilian butt lift, but they've also had just regular off-label black market buttock injections.
Okay.
So it's kind of like, the celebrities have kind of done everything. And it's kind of up to us to educate the public on what these things might be and let them know, like, you might not necessarily want to go for that, because if you go for these exaggerated results, then they're not going to age well. Like if you're talking about, it's kind of dropping down, doesn't look the same.
Oh, yeah.
Extremes don't age well. Our tagline is natural but noticeable.
Okay.
I want everything that I do to a patient to be able to age well with them. I don't want 10 years from now someone saying like, yeah, Dr. Baron did my surgery and look at me now. And I'm like, no, we don't want that.
Nope,
We want patients to be able to age well with this. So,
and I think just going off of what you're saying, I think in plastic surgery or in the aesthetic world in general, there are a lot of trends that come and go.
Okay.
And the thing is, you never want to be following the trends, especially with your body, with your face, you were made the way you were made, and that can be enhanced, refined in different ways, but the goal is to still keep you looking like you. And you never want to be, because those trends, like I said, are going to come and go. And 10 years from now, what looks good now isn't necessarily what's going to look good then. You're always going to be playing catch up, and that's not what you want to do with one, major surgery, and two, with your body in general. Right. So really it's just figuring out what your particular aesthetic ideal is in the setting of your body, and us sticking to that goal and not trying to stay on top of what the latest trend is. Because as you see, even with fillers, now the trend is going more natural and people dissolving things. So if you are someone that really ran away with the idea of like really, really high cheekbones and crazy defined jawline, now you're going to be trying to reverse all of that. And one, it costs money to do those things. And two, you kind of lose yourself in that trying to chase your tail. Really what you want to be doing is just focusing on what you think will make you look good and what will remain natural long term.
What's the patient's responsibility to you guys? And it's like, how many visits do you see a patient before you decide, okay, I'm willing to do surgery on you, or what health requirements do they need to have in this type of thing?
You want to go?
Yeah. So so for me, Dr. Baron mentioned, I'm interviewing the patient as much as the patient is interviewing me. It's a two-way street. I don't want to operate on anyone who I don't think is going to follow post-operative instructions, right? Because again, our goal is to do this safely and to do this in the best way possible. So we sort of join into a partnership where we're a team, and I do my part in doing the operation well, safely, with the best technique. And your end of that bargain is to follow the instructions that will help you keep that result. So that's the first thing. I think when in our practice, the way it works is you come in for a consultation, which is usually 30 to 45 minutes. The patient discusses their concerns. We examine them. We talk about what we think the best plan for them is. And then at that point, the patient can then decide if they want to proceed with surgery. Now that time period can be a matter of days, it can be a matter of weeks. But really for me, it's like, I'm happy to talk to a patient a second time. I'm happy to have you come back a second time if you have extra questions. You want it. So we can do multiple consults really just to make sure that we're on the same page. Because I want to understand what your goal is, and I want to make sure that I can achieve what you want before we enter the operating room. After surgery, so then you get a preoperative appointment for surgery. And in that point, we're going over, you've gotten clearance from your doctor. We're going over your lab work. We're making sure you're safe for surgery, that there's nothing that needs to be optimized with regards to your health. Surgery day happens, and then you're seen in clinic a week after. I love seeing my patients. So I'm going to see you a week after. I'm going to see you at 1 month. I'm going to see you at 3 months. I'm going to see you at 6 months, and I'm going to see you at a year. I just want to make sure that there's no point in time that anything is going off course or off plan. And if there is, then we're right there to help you to figure out what we need to do to make things go in the direction that they should be doing. We want to make sure that patients aren't scared after surgery. And if they have any questions, that they're answered. Our phone, you can call at any point during the day. Someone will get back to you. And I think that's really what you get having a doctor that or a surgeon that's here with you, as opposed to having a doctor that's in a different country where they're potentially speaking it. There's a language barrier.
Yeah. They get full service.
Exactly.
Okay. It's all inclusive, really when it comes down to
Yeah.
it. And so there's no one night stands.
No.
Okay.
We
Not at
will
all.
not operate and then not see a patient. I see patients from out of town all the time.
Okay.
But I let them know, like, if we're going into this, if we're going to do this
Back.
together, you have to have the means to come back.
Okay.
Not only for, just routine post-ops, but if for some reason there is a minor complication or anything like that, I'm going to want to see you. And sometimes it's more than just a video visit. You have to put hands on a patient,
Okay.
And so I let them know, like, it's a commitment. If you're coming from California, you have to be able to come back if for some reason something happens, or you need to be able to stay in Atlanta for a period of time, or, if anything. But I like to see back and see my results, because that's how we learn. The
Okay.
best way that we learn, from different body types, different tissues, things like that. We're going to be able to learn best by seeing our patients. Even our long-term results are where you learn the most, years later, so that we know exactly, that we're doing the best thing for that patient.
Now, what are some of the potential risks involved in plastic surgery? I mean, it's surgery, so we know there are, risks. What are some of those risks that patients encounter?
Well, any risk
Or need to be aware of?
Yeah,
rather?
there's a risk with any type of surgery. There are, general risks, blood clots, bleeding, infections, things like that. Those are, when it comes to plastic surgery, most of those are minor. There's general risk from anesthesia, but we disclose all that to the patient. That's the important part of having an informed consultation.
Okay.
Having a pre-op appointment to where they can bring a family member and, talk about things specifically, related to the surgery. The most risks are minor, but as far as plastic surgery, when it comes to like larger procedures or longer procedures, like mommy makeovers, where you're combining like a tummy tuck and liposuction, potentially blood clots. That's something that patients are very concerned about. That's what we're very concerned about.
Okay.
So we make sure that we put in the correct measures to decrease a patient's risk of having an adverse event after surgery.
Now what's the patient's responsibility after this? Because a lot of with these mommy makeovers, if you're just taking it out, it can come back, right?
So
I hear on the radio they advertising now you can stop the fat, it won't ever come back. But
no, not necessarily.
There's no magic bullet.
Yeah. So yes, I remember seeing something saying that fat cells have have accepted their Lord and Savior Jesus Christ because they live forever and they have eternal life. But no, the patient's responsibility, and we talk about this, is that they have to keep up the results.
Okay.
Just like they've, done the research for this car or this house that they're buying, the investment in themselves, the same thing. You're not going to buy a car and not change the oil. Well, I guess some people, but, or not change, put air in the tires and that whole type of thing. You need to keep up this investment. And I tell patients that all the time. So that involves being healthy prior to surgery, being healthy afterwards, not smoking cigarettes, really keeping up a workout regimen so that you can continue to fine tune results. Because if I do a tummy tuck and everything's nice and tight, but you just do nothing and you just let it all hang out, my repair will be tight in the center, but then sometimes people can stretch around that.
Wow.
I've had patients who come back, a year later and they've gained like 40 pounds. Yes, I can take your money and operate on you again, but I really don't want that from my patients. I really want them to, really sustain the results that we intended to have when we embarked on this plan to begin with. And so you need to keep up your results by exercising, having some degree of level of fitness, eating well, and like we said, not smoking, prior to surgery or for a certain period of time afterwards, because that can affect the blood supply of your tissues as they're trying to heal. So, just as much as we have skin in the game, when it comes to operating, the patients do too, because we want them to be happy afterwards. I don't want patients just coming back because they're not adhering to, the post-operative plan, because there will come a point in time where I'm not going to operate again, because it's just too much, because, plastic surgery is not weight loss surgery. You
Okay.
know, it's not a cure all or a fix all for any type of, issue that you might be going through. And so that's what the important role that we have as surgeons is really trying to suss out, a patient's motivations and making sure that they have the correct motivations when they want to have surgery, because everybody's not a good candidate. And I say no all the time.
Okay.
When it comes down to it. So
I think that's one of the most important parts of being a plastic surgeon is understanding when to say no and being able to say no easily.
Now, y'all ever deal with I cannot think of the name of this disease that causes people to do this, but the people that just get way too much plastic surgery and they just keep coming back.
Body
I want my
dysmorphia.
nose. Yeah.
Yeah. I mean, it's not necessarily a very common
Okay.
Like
condition.
true
It's
body
true
dysmorphia.
body dysmorphia. I think a lot of people have parts of their body that they're not happy with, and I think with social media that there's a little bit more of like nitpicking and
Okay.
being very judgmental about ourselves specifically. But true body dysmorphia, the diagnosis itself, it's not very common. But when you do come across a patient like that, really the most important thing is not operating on them
Okay.
and referring them to the help that they need, which is usually a psychologist or a psychiatrist, which are the people who can help them understand that what they're seeing about themselves is not truly what's there. Really operating on a patient like that is doing them a disservice. So it's really understanding that and trying to help them get the help that they need.
Wow.
Yeah, but body dysmorphia is really a patient obsessing about a certain body part.
Okay.
And not in, like she said, seeing something,
That
so
we-
a lot of people think that, Michael Jackson had body dysmorphia when it came to his nose.
Yeah.
That, initially after the thriller photo out, where you got the first couple of nose jobs, everybody's like,
It was crazy towards the end of though.
Yeah.
He looked like a skeleton.
Yes, but the thing is that you will find, where initial surgeons may have said, no, you don't need another operation. There's always somebody
someone
who
who will
will
do it.
potentially operate. But just because you can doesn't mean that you should. So I think it's important. There's a certain amount of kind of psychological evaluation we have to go through with the patients to, make sure that they have those correct motivations. But it's tough out here when it comes to social media.
Okay.
You have these Instagram models that are all over your feed, but the majority of them are using, well, I wouldn't say the majority, let me not get beat up on but there's a subset of people who are using, and to which it's not really real.
Okay.
They're using Photoshop, they're using filters.
Oh yeah.
Patients are coming in talking about, oh, I want to look this way, how this filter makes me look or whatever, and so I think, some of those things can be potentially dangerous, mentally, for patients. And I think, we see it affects their mental health and they want to look in real life, how they look in a particular picture, but I see a lot of patients when it comes to the body, they're like, oh, I need my waist smaller. And I'm like, your waist literally can't be smaller because I'm feeling your rib cage right here. With the, people know how to work the angles when it comes to photos.
Okay.
And a lot of these women that you see with these tiny, tiny waists and, fuller hips, it's not necessarily that their waist is so tiny. They may have gotten fat injected into the hips or fillers or anything like that to make the hips appear wider and the waist appear more narrow.
Crazy to me. I don't know what's wrong with these
or
folks.
it's a filter or it's Photoshop or whatever, So I think, not going with the trends like Dr. Familusi said, are important. And really, if there's something that you want to change about yourself that you've always wanted to do, or if it comes up, then that's okay.
Okay.
But going with the trends just because everyone else is doing it will never, fare out well in the long run.
I was looking on Instagram the other day. I was just scrolling through it and I forgot what I was actually looking at. But a new thing is vaginoplasty. Like, are you serious?
Well, it's not.
It's for real?
It's not necessarily.
Okay.
It's not necessarily a new thing. There are some women who, for multiple different reasons, want some aspect of vaginal rejuvenation. Whether that's after childbirth and they're having issues with incontinence.
You can rejuvenate it.
Yeah.
All right.
For that reason, or they're having pain, and there are different procedures
Okay.
that you can do to help with those symptoms. So yeah, it's something that some patients need, and people are happy to provide that service for them.
So is there such thing as a penile plasty or?
Yeah,
I guess you can just put
Yes.
plastic behind anybody part
Yeah, well,
and make
yeah,
it something,
plasty
right?
essentially means modifying
Yes, or
something. So
changing
yes,
it, yeah.
yeah.
Yes, you can. I mean, people do fat grafting to the penis to increase the width. They do
Really?
penile implants. That's
Mhm.
penile implants and stuff like that are normally done by urologists.
Okay.
But there are some plastic surgeons who are doing, fat injections to the penis to increase the width and things like that.
It's not our ministry.
Not a service that we offer, so we'll leave that
Oh, my
to those
goodness.
experts. But
You ain't got to worry about them. I'm not interested. I'm good. Tell us a little bit about your practice. Where's your practice located?
So our practice is located in Marietta,
Okay.
right off of Windy Hill Road.
All
Very accessible, close to Truist Park. Accessible to all the highways. It is breast body beauty, plastic and reconstructive surgery. We offer really the full range of plastic surgery. Breast and body contouring, breast
Okay.
reconstructive surgery. And what does that mean? Breast contouring or cosmetic surgery, breast implants, breast reductions, breast lifts,
Okay.
fat grafting to the breast. As far as body, liposuction, tummy tucks, Brazilian butt lifts or gluteal fat transfers, thigh lifts, skin surgeries for after patients have had massive weight loss,
Okay.
or arm surgeries, brachioplasties. When it comes to the body. In addition to that, Dr. Familusi and myself do eyelid surgeries, liposuction of the chin, minimally invasive or non-invasive to the face. She's gonna take up the facelifts, neck lifts, all those things that are gonna keep people aging gracefully.
Chin augmentations.
Yeah.
The
You
list
know,
goes on
And we do
on.
Botox and fillers, and then some, energy-based services in the office to kind of, have people, come in on their lunchtime and get some rejuvenation.
All right. I need some rejuvenation for you. Because now I feel some type of way.
Oh, no, you look fine.
You look
fine.
wonderful.
No, you do not.
But
You do not.
sunscreen and skincare,
Everyone needs.
Okay.
Everyone
does.
needs. So
Yes.
That's it. I'm
I
trying to
preach
stay light
about-
skinned. I ain't trying
preach about skin. That's the best way to stay young. Take care of your skin.
Exactly.
All right.
Exactly. And eat well. Eat right.
Now,
Don't work out.
if anybody wants to find you, if they want to book an appointment, how can they do that?
Well, they can give our office a call. Our number is 678-540-1144. They can go to our website, which is breastbodybeauty.com. You can reach out to me on social media, or actually the practice page on social media, which is at breastbodybeauty. My personal handle is at breastandbodydoc. And Dr. Familusi's
Mine is at Dr.Familusi.
All right.
so
You're
they
going
can
to have to
reach-
spell that for our audience. We enjoy it.
FAMILUSI.
Yes, and so they can reach out to us on Facebook, Instagram. We have TikTok pages, LinkedIn,
Okay.
the whole gamut. But we're easily searchable on Google. So,
All right. What's the best way for anybody that might be watching or listening? What's the best way for them to book an appointment?
really to call the office.
Okay.
Call the office. You can speak with our patient coordinator to really figure out what procedure is the best for you. And we can get you scheduled. We're always open for new consultations. Dr. Familusi is already busy and, really
Go.
wanting to, really get out there and offer her services. So we're available.
Now, is this just for patients that might be watching? Is this something that's typically covered by my insurance, or is this something that I need to be expecting the cash pay?
So reconstructive procedures, so some breast reductions, and breast reconstruction after cancer,
Okay.
those reconstruction after skin cancer, that's covered by insurance. Cosmetic surgery, so some of the breast and body contouring, so breast augmentation, breast lifts, tummy tucks, mommy makeovers, facelifts, Botox fillers, those are you would pay out of pocket for. Those are not
Cash
covered
pay.
by insurance.
Okay. Well, just give us that number one more time so everybody can write it down.
It's 678-540-1144. You can reach us at breastbodybeauty.com, on the website. And, we're here.
I'm coming and get a consultation. The consultation free. She said, "No, I ain't giving you no free consultation."
So consultations are $100. It's because our time is valuable. We're going to sit down for really about an hour with you, talking with you, examining, really giving a good plan, giving a cosmetic or surgical quote when it comes down to it. So, the thing is, our time is valuable. So,
All right.
it also decreases the chance that people just no show. So you
There
got to
you
buy
go.
in.
Hey, people don't value what they don't pay for. I got to tell you.
Exactly. It's very true.
Well, once again, it has been another wonderful episode of Number One Rated Business Show. Thank you so much, Dr. Familusi and Dr. Baron, for coming in, spending time with me today and explaining this world to us, because it's just amazing the explosion that we're seeing, and people wanting plastic surgery and wanting to better themselves and be more beautiful and more vibrant looking. I do feel some type of way now because he.
Don't look too hard on it. No, but thank you so much. We really appreciate the
Thank you.
opportunity to come and talk to you.
Not a problem. Until next time, shout out to my engineer today. Thank you so much for jumping in and helping me. Love you so much, Miss Just Love. I told you I was gonna get you. But no, thank y'all so much. I will be back next week with another great guest. Until then, we are out. You are welcome.